if you look at a human being, a person, we're not just symptoms or the sum of our symptoms or diagnosis codes or dysfunction. So, what existing models or frameworks can help us improve our approach to providing person centered or human centric healthcare? The one that I am a big fan of, it's a whole chapter in my book, Better Outcomes: A Guide to Humanizing Healthcare. Taught about it, researched about it a lot, and now help clients with it, is the biopsychosocial approach, which basically means if you look at a human being, a person, we're not just symptoms or the sum of our symptoms or diagnosis codes or dysfunctions or limitations, whatever it is. Humans are uniquely complex, but each person has the biological component, which is what a lot of healthcare focuses on, that pathophysiological dysfunction, the disease, the inflammation, the symptoms, physical symptoms. But there's also the psychological component or the cognitive component, and then the social component or the environmental component. So what is happening in the person's environment that is affecting either their attitudes, their psychology, their thinking about their healthcare, their health, or their outcomes, and how does that impact their physical function or the pathophysiological functions going on. So whether it's a developing software or some kind of tech tool to improve chronic disease management, for example, if we're building it from the standpoint of these are the lists of symptoms that we're solving, or these are lists of dysfunctions that this chronic disease causes, and this is how the software is going to fix it, unless we're taking into account the other factors, the non-medical factors, if you would, the psychological, the environmental, the social, then those tools are often going to fall flat because we're going to be solving for one problem when there are all these other ancillary factors that are affecting the main problem that we're trying to address. So taking a biopsychosocial approach helps with clinical service delivery, but then also tech tools, platform development around solving some of these longer term issues. And you're seeing that both in the literature with the social determinants of health taking a more prominent role, and as well as clinical service delivery now in the field of like chronic pain, which is where I spent a lot of my clinical work, that it's not just so much about the muscles and the tissues and the joints. It's also looking at the fear of movement, the psychological, the psychosocial stressors that can impact perceived pain, as an example. So long answer to the question, but taking a biopsychosocial approach, looking at people in their entirety and then building solutions around that instead of a set of symptoms or a set of problems.